In South Africa, the complexity of location and segregation is still a real barrier to people with disabilities. The Shonakop Social Enterprise, we've been started and founded by a parent of a child with severe disability. As an organisation, we are trying to address all the barriers that families face in their community. My name is Erna van der Westhuys and I'm an Atlantic Fellow for Health Equity in South Africa based at Tucano. Morning. Morning, Ralph. How's life? Part of the South African context that we live in, people with disabilities need to go into areas where there's no roads, clay roads, sandy roads, like no actual formal roads. When people import devices from across the world, they are simply just not made for our environment. So we manufacture mobility devices built for the South African context. We have also set up a mobile education and social connection platform for parents of kids with disabilities, which we call the Parent Network. The Parent Network is a catalytic community of parents of children with disabilities that's coming together, that's organizing themselves in a particular way to get information from really grassroots level, lived experience of people. Really it's about creating quality information and then share the information to parents of kids with disabilities. The Solidarity Grant really helped me to escalate the making of new knowledge, specifically acknowledging that parents know enough. They've got specific skills and experiences, so we've been making videos to capture their own knowledge, but also to spread it within the Parent Network. We are in Malmesbury at Mama Malema's house. She's one of our network parents and we are shooting one of the videos at her house today. What we found, specifically in the time of COVID, it is almost as if it highlighted the issues that we've been dealing with in any case. Access to health services in general is a challenge because it depends on your severity of your disability where you are actually being seen. We're going to try and tell the story of not having to be able to access the services during COVID. There's been many months now that she couldn't access the clinic.
But kodwa ngexesha le COVID kube nzima kakhulu ukuthi thina abantu abanakhubazekile because sometimes awukwazi ukumfaka imask ezinto akayifuni imask and ngoku uyisoloko sisendlini ixesha elininzi because it's difficult ukuhamba.
So it's Mama Lema's story today. She created the story herself, but it's also the story of many other parents and many other families. So through doing that and just telling her story, she will also create awareness with other parents.
Ndivuye kakhulu, ndivuyile ndonwabile. Ngesisitongela ibali endilenzileyo. Ndivuyise kakhulu xa zabonwa ngabanye abazali nabo bazazi ba xa benabantwana abanenkubazeko ezindlini zabo is not that ba punishment leyo. Masibatreat njengabanye abantwana.
It's really how do we reach far more families in South Africa by doing it with parents, in partnership with them and not thinking that we must be the people to do that always. Thinking about how do we work with the parents moving forward. We've been innovating and really experimenting with new ways of doing that in any case. The grant has definitely been a catalyst to take that forward and to make that a real thing. My understanding through COVID, for the first time I felt personally what it feels like to be isolated. When we adopted our daughter, we knew from the start that she's prone to having chest issues. So I also had to battle with not understanding a medical background. Obviously it's two worlds apart, but it really grown my empathy and awareness. I feel so passionate about the fact that we need to find a way for parents to reclaim their power and stand in their own knowledge. So it's important to acknowledge that the parents are the knowledge holders of what's happening in their children's lives.